Hello, I'm Paul Jacobsen, and I'm honored to serve as the Acting Regional Director of the U.S. Department of Health and Human Services Region 1 Office, which includes all 6 of the New England states and 10 federally recognized tribes. Our regional office is the front door to HHS in this area and can answer questions, provide information, and assist with resources for the work that you're doing. On a day-to-day basis, my team is engaged in meaningful dialogue with governors, mayors, tribal leaders, and partners like you about HHS policies, programs, and regulations to ensure our efforts are informed by your experiences. Some of our priorities from the beginning of the Biden-Harris administration and Secretary Becerra have had clear objectives: tackling COVID-19, reducing healthcare costs for the American people, expanding access to health care, addressing healthcare disparities, and strengthening behavioral health. And I'm happy to say that we've made real progress in these areas. Today, we have more tools than ever to prevent, fight, and treat COVID-19, including vaccines, boosters, and therapeutics. At the same time, I want to acknowledge that the COVID-19 pandemic emphasized the fact that inequalities still exist in our healthcare system. More vulnerable communities still live in fear of getting sick, particularly disabled, immunocompromised, and older Americans. We cannot leave them behind, and we will not leave them behind. One of the major pieces of work we do here in Region 1 is focused toward advancing the HHS vision of health equity. Through HHS interagency and community partnerships, we began the Regional Resilience and Equity Collaborative, which was launched in October 2021. That was created to address the persistent health and social inequities influenced by the social, structural, and environmental determinants of health and well-being that negatively impacted communities. By forming strong partnerships and promoting promising practices, prevention policies, and programs that result in a community's ability to recover quickly, we ensure that communities are left better than they were before. Our HHS achievements in the future, we're also looking around the clock to ensure that no matter who you are or where you live, you can access health care free from discrimination. In the last year, we've also made progress in expanding access to health care to more Americans, especially individuals, marginalized communities. For example, during 2022 open enrollment period, a record 14.5 million people enrolled in quality health care coverage in the marketplace, including nearly 6 million who newly enrolled for coverage. Additionally, we have prioritized behavioral health and invested billions in programs, block grants, and other initiatives. In October, we rolled out a new strategy for overdose prevention, one that prioritizes not just prevention and treatment, but harm reduction and recovery support. Looking ahead, we will continue building on this great work, and that includes implementing the new White House COVID-19 plan to protect against and treat COVID-19, prepare for new variants, prevent business and school shutdowns, and we will continue to be proactive in addressing mental health, which the President has made a national priority in 2022. In closing, my friends, the administration, with your help, has made significant progress, and yet there's more work to work ahead. I look forward to working with you and serve the people of Region 1. Thank you again.
Produced by the U.S. Department of Health and Human Services.